Scott Ratzan joins me now from Princeton, New Jersey. He's the Executive Director of Business Partners to Convince, a global communication and education initiative, as well as the Editor-in-Chief of the Journal of Health Communication, International Perspectives. Thank you very much for your time, Scott. Now, can you tell us more about the theme of this year's Assembly, Health for Peace and Peace for Health, and what the main objectives are?
Well, thank you for having me today. I really appreciate the fact that we're actually talking about the World Health Assembly, because for many people, it's just a place where is sort of amorphous. People now have been going for nearly 75 years. The people now, 194 member states, go to Geneva, health ministers, and they talk about important issues that affect everyone in the world. But yet, the resolutions and the pieces that come out of there are broad and long-term. So how do we build universal health care for 1 billion people? How do we make 1 billion people healthier and more well-being? How do we give another billion people the opportunity to learn about health and also to be healthier? These are the kind of things that are broad-based policy initiatives. And in the midst of a COVID pandemic, we still have a lot of challenges that even out of Geneva, when everybody gets together, we can't seem to solve these right away.
And what more can you tell us about the WHO's approach to monkeypox? How concerned should we be?
Well, I think all of these issues that we hear about infectious disease are a concern, right? We hear about hepatitis, we've heard about Ebola, we've obviously been focusing on COVID, and every year we still have people dying around the world from malaria and other diseases that really are causing more deaths, principally in children. So the monkeypox piece sounds kind of scary. Is this the next thing? Is this the next Ebola? But in reality, this has been around since 1958. It was first identified in Denmark, actually, with monkeys in a lab. And it wasn't really until the 1970s where it started to be seen in people. And fortunately, if I can say, while there are anywhere from 200 to 400 cases, depending on the counting, in 20 countries where we really don't see it, it's really not a major concern that we have to, oh my gosh, stop everything in such a way. In fact, if there are symptoms that people have, which is fever and swollen lymph glands, a few days later, some people go on to get this rash with pustules that are the pox pustules, and that's when they actually would have monkeypox. So it's very difficult to say that it's spreading widely. It doesn't spread like COVID, a person-to-person contact without close contact. When people are asymptomatic, when they don't have any symptoms or no pox pustules, it does not seem to be spreading. So all in all, yes, it's something we should pay attention to. We always should be tracking viruses and knowing their genome sequence. And fortunately, if I can say, this is the West African strain, which seems there are other strains that are worse. So for better or worse, it's out there, but it's not anything we need to be super concerned about.
So we know that Moderna has started clinical trials on a monkeypox vaccine. How important do you think it is to immunise against this particular virus, and how soon can we expect it to be available?
Well, fortunately, the smallpox vaccine, which many of us had, including myself, as a child, seems to be protective against monkeypox. And in fact, if you were not vaccinated, and many people under the age of 45 globally have not been vaccinated with smallpox, if you were exposed to monkeypox and had the fever, you could actually get a vaccine within 4 days of the smallpox vaccine, likely to work 85% of the time. And whether it's Moderna or any other group that might have a new vaccine for monkeypox, that also could be something that could be deployed quickly. But it's very different than COVID. It's very different than measles and a lot of other vaccines that we have already on the market.
Speaking of COVID, can you tell us a little bit more about the COVID-19 pandemic treaty and how the Assembly is looking at ways to counter COVID conspiracy theories?
Well, I've been at the World Health Assembly as an observer. Their only official seats are the member states, and generally they send their health minister. There are some others who are engaged, other organizations, but the treaty will take some time. There was an international health regulations treaty over 15 years ago, which could have been more helpful in fact, even with SARS when we first had it and with COVID. There seems to be some idea in the media that this treaty is going to take away the rights of member states and individuals. I don't see that treaty being negative in that regard. Treaties are a good thing. First of all, if we were able to have a treaty that would explain something like monkeypox, is it an emergency of international concern? Is it a hazard? Is it an outbreak? Is it an epidemic? Is it a pandemic? Just some simple pieces like the World Meteorological Society, which is a UN agency, reminds us of storms and the threats that we have from climate. We could have a similar kind of treaty on health and using the health diplomacy that would be more positive than negative. So unfortunately, many people only see the negative in these treaties, but this was going to take some time, and with member states getting together, it would be a good thing to go back to the theme. Health as a bridge to peace, health for peace, and peace for health. All of these really work well together.